Thank you, Mr. Chairman. I offer Amendment 9, which stops reckless and shameful cuts to seniors in nursing homes. This critical amendment will ensure that senior citizens and people with disabilities will not lose vital Medicaid assistance to cover the costs of their nursing home care or home and community-based services. This amendment also ensures that low-income beneficiaries who are eligible for Medicare receive help paying their premiums and their out-of-pocket costs. In gutting Medicaid, the Republican budget jeopardizes health security for 5 million seniors, 10 million individuals with disabilities, and 28 million children. These numbers, these millions of Americans at risk for having their health safety net yanked from under them, represent our constituents who are counting on us to keep them from falling through the cracks. Unless we adopt this important amendment, the Republican budget sends the message that it's perfectly acceptable to lead seniors and the disabled down the path to poverty. But the impact of these cuts is so much more crippling than these numbers would suggest. As a member of Congress who represents a large number of seniors in South Florida, I can tell you that this budget would be absolutely devastating for seniors and older Americans. By cutting $810 billion from Medicaid funding and converting the entire program into block grants, this budget rations the health care services available to seniors by straining state budgets and leading many states to simply end the care that they provide. And this impact will fall disproportionately on the backs of vulnerable seniors. Though they only account for a quarter of all Medicaid beneficiaries, seniors and people with disabilities account for 2/3 of all Medicaid spending. Since that is where the bulk of spending occurs, we know that it would be this population that would suffer the most from the reckless cuts that would eventually befall the Medicaid program. We must stop these egregious cuts and the GOP budget that deliberately chooses tax cuts for millionaires and billionaires over health care for seniors and poor children. It's as simple as that. That's why so many seniors advocates have spoken out against this budget's completely backward approach. The National Committee to Preserve Social Security and Medicare said, "This is a budget that doubles down on an ideological quest to turn Medicare into a privatized voucher program, stacking the deck against traditional Medicare and creating a death spiral leading to its demise." The American Federation of Teachers said, "It is morally unacceptable and economically indefensible for House Republicans to put forth a budget that doubles down on a cuts-only approach to our economy at a time when our children and families continue to struggle to get by." And the Medicare Rights Center said, "Let's be clear. The budget introduced today by Representative Ryan is still a voucher plan that ends the Medicare program as we know it." The budget is and must be a moral document. It is a clear statement of our nation's values and policy priorities. Unfortunately, our Republican colleagues have chosen to prioritize tax breaks for oil companies and the wealthiest Americans, deductions for corporate jets, and loopholes that reward outsourcing, putting seniors, the disabled, and children at risk. Let us reject these backward priorities and once again work toward a future where we prevent our families from falling into poverty. Thank you, and now I'd like to yield 2 minutes to the gentleman from Maryland, our ranking member, Chairman Van Hollen.